Very interesting there. As of tonight, half of North Carolina's adults are now fully vaccinated, and the state is seeing its lowest percent positive of the entire pandemic. The progress is good, but is there any way that this could go wrong? We asked the experts what factors could derail us and when our next trouble spot could arise. We talked with Duke medical economist and former FDA commissioner Dr. Mark McClellan, SCDHEC's assistant state epidemiologist Dr. Jane Kelly, and infectious disease specialist with Novant Health Dr. David Priest.
We're always looking, what are our numbers, what's happening where, what's increasing, what could happen in the fall. Flu will probably be back this fall.
So we certainly have concerns about that, about influenza, for example, coming back with a vengeance. But in the immediate future, I think we are concerned about large gatherings. We do have a number of people vaccinated in South Carolina. I'm not worried about them. I'm worried about the unvaccinated people.
Doctors say it's likely if there are any surges, they'll look different than the ones of the past. Less widespread, with pockets of outbreaks in lower uptake communities. And they say it's important to keep an eye on what happens abroad.
With so many cases of COVID still happening in huge outbreaks outside the United States in populations that have not had access to the high quality vaccines that are widely available here, we're seeing more concerning variants emerge.
Fortunately, none that have been able to foil our current vaccines yet. The other good news, we've been at this for a while now.
We got a lot of experience now. We can pull levers to, put things back into place if we need to do that. Is there a time in the fall where, masking could be back for a time? Certainly.
And in the short term, the CDC's forecast shows COVID cases continuing to decline through at the very least the end of June. But the forecast only goes 4 weeks into the future at a time.